Can you distinguish the individual Pes Anserinus tendons on ultrasound? In this video, I will show a simple method that makes their identification easier and more consistent. Instead of starting directly at the Pes Anserinus insertion, I begin slightly more proximal, at the anterior edge of the medial collateral ligament. At this level, the tendons are thicker and easier to identify. The probe is placed along the long axis of the limb over the distal part of the medial collateral ligament, closer to its anterior margin. The medial collateral ligament is the structure lying directly against the bone. The tendons of the Pes Anserinus run superficially over the ligament. Their arrangement is SGST, Sartorius, Gracilis, Semitendinosus. At this level, the tendons are seen in transverse section. If we are not certain which tendon we are seeing, we move the probe proximally. As we move proximally, the tendons become thicker and easier to recognize. In the center of the screen, we see the Gracilis tendon. On the right side, Semitendinosus. On the left, Sartorius. Together, they form the Pes Anserinus tendon complex. Moving further proximally, the Sartorius tendon is no longer seen. Instead, a thick Semimembranosus tendon appears on the left side of the screen. For clarity, the Gracilis and Semitendinosus tendons are marked with arrows on the frozen image. Next, we rotate the probe and assess the tendons in longitudinal section. First, I assess the tendon on the right side of the screen. This is the Semitendinosus tendon, the thickest tendon in this group. Then I return slightly proximally and move from the transverse view to the longitudinal view of the Gracilis tendon. In longitudinal section, I follow both tendons all the way to their insertion. This approach helps avoid an incorrect diagnosis of tendinopathy. If we assess these tendons only in transverse section, even a small movement or slight tilt of the probe may produce an oblique section of the tendon. In that situation, the tendon may appear thicker than it really is. In addition, anisotropy may occur, something we do not always consider when looking at transverse images. As a result, tendon echogenicity appears lower, which may create a false positive impression of tendinopathy. Now look at this image once again. Can you identify the individual Pes Anserinus tendons? In a moment, I will show their labels. If everything was clear, excellent. If not, it is worth watching the earlier part of the video once again. If you found this material useful, I invite you to explore my other musculoskeletal ultrasound videos on this channel. In particular, I also recommend the video presenting the most common pathologies of the Pes Anserinus region. Please also consider subscribing to the channel and reviewing the links to scientific publications provided in the video description.